Assalamu alaikum. Now we are going to study about the nerves, muscles and the vessels that are present on the face and neck area. So if we look at the facial muscles, what we can see is that the muscle of the forehead is called the frontal belly of the occipitofrontalis. After that we have the circular muscle which is called the Orbicularis Oculi with its orbital part and the palpebral part which makes the eyelids. So this is the palpebral part of the Orbicularis Oculi and the lacrimal gland which we can see from the lateral part of the orbital margin. After that, this is the orbital part of the Orbicularis Oculi. This is the nasalis muscle. This muscle which is going from the nose towards from the root of the nose towards the lip. This is the levator labii superioris leak nasi. Beneath it, this muscle is the levator levator labii superioris. This is the zygomaticus minor. This is the zygomaticus major muscle. This is risorius. This muscle beneath the risorius, the deeper muscle, this is the buccinator which is pierced by the parotid duct. This muscle is the masseter which has the vertical fibers. Over here we can see that this is the parotid gland and the parotid duct which is extending over the masseter and piercing the buccinator muscle. So we were on risorius. After that we have a muscle which comes from the mandible towards the angle. This is the depressor anguli oris. This muscle from the mandible towards the lips, this is the depressor labii inferioris and this is mentalis. The muscle with the circular fibers, this is the orbicularis oris muscle. Alright, this is the levator labii superioris which was not very visible over there. Now, if we look at the nerves, this is going to be the supratrochlear nerve. This is going to be the supraorbital nerve. So, this is the supratrochlear nerve and artery. This is the supraorbital nerve and artery. If we look at the muscles on the floor of the mouth, we can see that this is the anterior belly of the digastric muscle, which forms a pulley and goes backwards as the posterior belly of the digastric. In front of the posterior belly of digastric, this muscle is the stylohyoid muscle. Here we can see the two muscles separately. This is the stylohyoid muscle and this is the posterior belly of the digastric muscle. This is the submandibular gland. Below the hyoid, we have in the midline or near the midline the sternohyoid muscle, omohyoid its superior belly, and the thyrohyoid muscle. Below it, there is the membrane which is the thyrohyoid membrane, and from here starts the inferior constrictor muscle as well, which is not shown. So this is the sternohyoid, this is the omohyoid, and this is the thyrohyoid muscle, which we can also see over here. This is the thyrohyoid muscle, this is the cricothyroid muscle, the laryngeal prominence, the thyroid lamina, thyrohyoid membrane, and this is the isthmus of the thyroid gland with the lobes present here. Alright, for the neck, this is the sternocleidomastoid with its sternal head and the clavicular head. After that, we have some muscles which are number 1, the splenius capitis, then the levator scapulae, and then the 3 scalene muscles which are the posterior, middle and anterior scalene muscle. Crossing these almost transversely, this is the inferior belly of the omohyoid. Revising them, this is the splenius capitis, then is the levator scapulae, then the posterior, middle and anterior scalene muscles, and crossing them is the omohyoid. These muscles are the landmarks for the nerves. The nerves coming out of the nerve point are the greater auricular nerve, transverse cervical nerve. This is the brachial plexus which is moving downwards over here with the subclavian artery and subclavian vein. This is the external jugular vein. Alright, and this is the trapezius muscle. If you look over here, we have the arteries. First we will talk about the muscles and then the arteries. So this muscle, sternocleidomastoid, was covering these muscles over on the right side, so on the left side we have, this is the scalenus anterior, middle and posterior, and this muscle is the levator scapulae, which is going towards the scapula. All right, so now if we look at the arterial supply, what we can see is that this is the external carotid artery. External carotid artery is giving off this branch, which is the superior laryngeal and the superior thyroid artery. The second branch of the external carotid is the ascending pharyngeal, which is not shown over here. This external carotid artery is this branch, and it is dividing into an internal carotid artery as well. So this is going to be in the internal carotid artery, this is the external carotid artery with its first branch, the superior laryngeal, then the ascending pharyngeal. This is going to be the lingual artery, this is the facial artery, and above this part is the maxillary artery and its terminal branch, and the superficial temporal artery. So these are all the arteries of the or the branches of the external carotid artery. If we talk about the nerves over here as well, or the other nerves that we can see, these are the mental nerves that are coming out of the mental foramen. This is the inferior orbital nerve, the zygomaticofacial nerve, the supratrochlear and the supraorbital nerves. Alright, after that we can see the bones. This is the zygomatic bone, this is the zygomatic arch, mandible, condylar process, coronoid process is hidden here, external acoustic meatus. If we talk about the facial artery, this is the facial artery, and it has the sinuous course where it goes over the mandible, and then it divides into an inferior labial, a superior labial, then the lateral nasal, and it ends at the medial end of the eye.